Welcome to the Acupuncture Outsider podcast. My name is Richard Hazel, and in the time it takes for you to commute to or from work, I hope to have shared something of interest about orthopedic acupuncture using motor points, trigger points, myofascial slings, neurofunctional acupuncture, segmental treatments, anything that crosses my mind that seems to be of interest. I hope you'll enjoy it. Hello, and welcome to another episode of the Acupuncture Outsider. This is Richard Hazel, and today I'm going to talk about a couple dry needling techniques that I used in the past 2 weeks on college football players. The first one is similar to the quadriceps tendinopathy that I talked about in a previous episode, but the player didn't have pain above the knee. It was right on the knee. It was painful, and it had just started. It was like, what would you call it? Insipid onset. It was not a known traumatic injury. It just suddenly started to really hurt right on the upper part of his kneecap. So I treated it as if it was similar to the quadriceps tendinopathy and was successful at alleviating the pain. And basically what I had to do was find sore, tight trigger points in the upper third of the rectus femoris, and I had to cross fiber medial to lateral very gently and slowly to get good twitches out of it. And it took probably 3 different sections of that to eliminate the pain, but we tested after each time. I would get a few good twitches out of it, and then once I saw that it wasn't really twitching anymore, I would have him test again, bending the knee and straightening the leg. It actually hurt more on extension of the knee. And it was getting better each time, and then after the third time, it was down to almost 0. So the same player was very concerned because in a few days he had an important game, and bilateral Achilles pain. That was it's something that has come up before, but it was really bad to the point that he could constantly feel it, and he was concerned because he wants to play, and this was going to definitely be an issue. So I always do a posterior chain, for performance reasons. So we did all of that in electric stim acupuncture on the gastrocs and soleus as part of that posterior chain. And of course, I look at Achilles as an issue of the posterior chain, a failure up the chain. And so I had, the week before, I had a similar issue with one of the other football players who had Achilles pain on one side, and the electric stim was not sufficient. And I said, listen, I know you handle dry needling very well and you recover very quickly, but you might be pretty sore for a day, but I really think we need to dry needle the soleus. And so I don't usually feel like I need to dry needle for Achilles pain. Every once in a while I will, like if there's like a lateral Achilles pain, I'll look for the lateral gastroc to have a trigger point, or same for medial. But this was almost certainly a soleus issue. And if you look it up, you'll see the soleus is about 70% slow twitch fibers, which are the more commonly contracted muscles. So the slow twitch fibers are the ones that are going to get stuck short. I use palpation to confirm soreness in the upper soleus through the lateral gastroc area, about 4 or 5 fingers down from the back of the knee. You remember there's like a tendinous arch of the soleus there that can entrap the tibial nerve, which runs right down the middle of the gastroc and soleus, like right down the middle. So the concern, of course, with dry needling is you don't want to get anywhere near the artery and nerve that are running right down the middle there. So I wanted to come from the lateral side of the soleus through the lateral gastrocnemius, and so of course I had to push hard, find the sore soleus, confirm that I could feel the tibia, the outline of the outer edge of the tibia, and because if you go too lateral, then you're going to get into only lateral gastroc, and you might get into the peroneus longus. So I was feeling for that border, and confirmed the sore, painful soleus, and went from lateral toward the medial. And of course, I didn't really need to go very far medial. I was really just trying to get a few good twitches just to see if we could relieve some of this Achilles pain. And I went very slowly. I confirmed that the place I was at, if I moved the needle in that one position, it was not uncomfortable. And I said, if anything's uncomfortable, let me know. And I stayed right in that area and got a couple good twitches, and then some huge, huge jumps from the soleus. And I had him, and he had been known to have a lot of issues with dorsiflexion because of this tension. And so I just asked him to just check it. He lifted his ankle up, he's face down, he bent his knee and pulled his foot up, and then he dorsiflexed way better than he has in a long time. And he kind of chuckled about it because it was like noticeably better dorsiflexion and almost no pain. So we stuck with that. I didn't do any more than that. And he was very happy about it because he had a lot of relief from that. So the player that had the knee pain, I did the same thing for him on both sides. And again, had huge improvement of the Achilles pain. Like it went almost down to nothing. He said, I can't believe how much better my Achilles feel. And I'm so glad I'm going to be able to play. And the same with the knee, way, way better. So I wanted to share that because it's not something that I commonly do. It was kind of like, what else can I do to improve this function? The structural people will stick needles into the Achilles and then electric stim them, but that really only temporarily blocks pain and decreases inflammation, but it's not a fix. It's going to last for more than a day or so. It really is just calming things down. So I don't like to just do something that's going to block the pain and then trick us into thinking that it's better. So I wanted to go more structural, more like more thinking functionally, like what is still pulling on the Achilles. Like if the Achilles hurts, then there's gastrocs and soleus are still pulling because that's their shared tendon. And so I just thought up the chain, and I'm feeling the gastrocs and not feeling anything that feels like it stands out to me as a major problem, but then pushing deep and feeling the density of the soleus and getting confirmation from the player that there was a lot of almost pain in the soleus. So that's what led me to dry needle them, the soleus on both of those players, and with great success, lateral to medial and just not going too far toward the midline. And really, I think I was able to only use couple centimeters of the needle. For dry needling, I use a 30 gauge, because if you use a thinner gauge, while you think you're helping the person with a less uncomfortable needle gauge, you're actually gonna have to needle a lot longer to get the hyperexcitation of those trigger points that you need. So go with a thicker needle. It's actually nicer for the patient to have the twitches come quickly and be done with, and not have to hyper irritate it with a thinner needle. So, so I was a 30 gauge that was 50 millimeters, and I probably only needed 2 centimeters of it. And remember, this is a big leg. This is an elite athlete, so 2 centimeters on him was just barely getting into the soleus. I just pushed to depth, felt for the soleus, started on the outer edge of it, and just moved the needle very slowly and methodically until we could get some twitches. And then I said, "Are you okay?" He said, "Yeah." I kept going, and then we got big twitches. And this happened with both players. Sort of a wind up of good, some couple twitches, and then the big ones where it actually, I think, moved the ankle, and then huge relief for the Achilles. And they're fine with some soreness in the upper calf when you get rid of that Achilles pain, and you improve their ankle mobility. So I wanted to share that technique and the outcome, because there are some times that I think where dry needling is really the best thing you can do to get a fast result for somebody. Some people have a lot of treatment time. They can wait several treatments to get more release of the muscle, but I think in some cases, dry needling's the best and maybe the only thing in this case that would have gotten the muscle back into a more functioning, elastic state. It was just stuck and ischemic and contracted. And obviously the pain in the soleus was noticeable way up, all the way up behind, just, upper calf area. Even though the players were feeling it all as Achilles pain, I think it's kind of a pain referral from the whole soleus that was being felt at just the tendon. So in this case, it was really, really helpful. And I wanted to share that in case there's others working with athletes where you're finding that just electric stimulation of the triceps surae muscles is not cutting it. And of course, you have to be very careful. And I'm not trying to tell anybody to do anything that you're not trained to do. But those who have been working with acupuncture, dry needling for a while, I think you'll find this is a very useful, helpful approach for the athletes with chronic Achilles pain. Okay, so that's all I have for today. Let me tell you, I'll put it in the description, but I'm doing a 20% off Black Friday discount for all the Podia online courses and bundles. So you can get 20% off even the already discounted bundles. The bundles of courses are discounted at 20% already, and you can use the 20% discount on top of the already discounted bundles. So it's a really, I'd say, very, very good opportunity to get courses at really affordable prices. So I'll put the information in the description. Okay, take care. Have a good one.